When we talk about JCI accreditation, one of the first things surveyors focus on is the International Patient Safety Goals, also known as IPSGs. These goals are designed to help healthcare organizations prevent the most common and serious risks to patients. The purpose of the IPSGs is to promote specific improvements in patient safety. The goals highlight problematic areas in healthcare and describe evidence and expert-based solutions to these problems. There are 6 core IPSGs under JCI's patient-centered standards. IPSG 1. Identify patients correctly. This means always using 2 patient identifiers, such as full name and date of birth, before administering medications, performing procedures, or providing treatment. This helps avoid serious errors like treating the wrong patient. The most basic requirement is that the organization develops and implements a process to improve the accuracy of patient identifications. IPSG 2. Improve effective communication. Healthcare is full of critical information. This goal ensures that messages between staff, such as verbal orders or critical lab results, are communicated clearly, completely, and confirmed when necessary. And here the JCI requires that the care organization develop and implement a process to improve the effectiveness of verbal and/or telephone communication among healthcare professionals. IPSG 3. Improve the safety of high-alert medications. Certain medicines have a higher risk of causing serious harm if used incorrectly. This includes things like chemotherapy drugs, anticoagulants, and concentrated electrolytes. The goal is to have special handling, labeling, and storage for these medications. The criteria should be developed and implemented throughout the organization, and all staff must be well-oriented on these high-alert medicines. IPSG 4. Ensure correct site, correct procedure, correct patient surgery. Before any surgical procedure, JCI requires organizations to follow strict protocols like site marking, timeout, and team confirmation. The organizations are required to develop and implement a process for the timeout that is performed immediately before the start of the surgical or invasive procedure, and the sign-out that is conducted after the procedure. IPSG 5. Reduce the risk of healthcare-associated infections. The 5th International Safety Goal focuses on basic yet critical practices like hand hygiene, sterilization, and infection control policies to prevent patients from picking up infections while receiving care in any organization. Here, the organizations are required to adopt and implement evidence-based hand hygiene guidelines to reduce the risk of healthcare-associated infections. IPSG 6. Reduce the risk of patient harm from falls. Falls are one of the most common hospital incidents, especially among elderly patients. JCI expects organizations to assess fall risk, use signage, and implement prevention strategies like bed rails and staff education. There must be an established process to reduce the risk of patient harm resulting from falls for the organization's patient population. Together, these 6 goals create a strong foundation for patient safety in any healthcare facility, whether it's a hospital, clinic, or outpatient center. For more simplified healthcare quality content and JCI accreditation tips, please subscribe now to the Quality Pharmacist.